Hi, my name is Annalisa Escudero, and today I'm going to be speaking about emphysema. Emphysema falls under the umbrella term COPD. COPD is defined as a chronic obstructive pulmonary disease. Emphysema specifically is the abnormal and permanent enlargement of the alveoli, as shown in the picture below. To the left, you see a normal alveoli in a healthy person, with the alveoli still intact. To the right, you see the alveoli within a person with emphysema. As you can see, the one on the right shows damaged alveoli and an abnormal shape as opposed to the one on the left. The main causes for emphysema are secondhand smoke and smoking. This picture shows how smoking can progressively damage the alveoli within the lungs. First, the harmful particles attach to the walls of the alveoli within the lungs, which then cause the alveoli to become inflamed. Then, the inflammatory chemicals dissolve the walls between each air sac within the alveoli. This results in an enlarged air sac filled with carbon dioxide, allowing the person to reach respiratory acidosis. There are many signs and symptoms that go along with emphysema. Some of those are shown below. An increased respiratory rate can better be seen as an increase in ventilation and a decrease in cardiac output. This means that the patient will breathe more, but their heart is slowing down. Patients with emphysema are often referred to as pink puffers because they can resemble a red to pinkish appearance in their skin. They often have club nails as shown in the bottom right picture, are barrel-chested, suffer from dyspnea or shortness of breath, have a non-productive cough, meaning that no mucus is produced when they cough, often feel tired, and will more likely lose weight. The picture in the top right shows a better representation of a person with emphysema. 3 tests that can be done to test for emphysema are as follows: a PFT, a chest X-ray, and an ABG. A PFT is a pulmonary function test which will show a decrease in tidal volume. Tidal volume is a volume of air within the lungs. A chest X-ray will show that the lungs have hyperexpanded. An ABG is an arterial blood gas test and will show you that the person is acidic due to the buildup of carbon dioxide within the alveoli in the lungs. Treatment for patients with emphysema can be to stop smoking for those who are smokers, bronchodilators, and pursed lip breathing as shown in the top right picture. For patients with emphysema, it is not recommended that you give them oxygen as a treatment. This is because patients with emphysema have no problem breathing in the oxygen, but have a problem breathing out the carbon dioxide when exhaling. Giving them more oxygen will in turn allow the oxygen that you are giving them to be converted to carbon dioxide that will get stuck into their lungs. This will then in turn result in a collapsed lung, eventually leading to your patient's death. Now we are going to look at the differences between emphysema and chronic bronchitis. As mentioned in the before slides, emphysema patients are often referred to as pink puffers because of the pink to reddish tint in their skin, as opposed to those patients with chronic bronchitis are known as blue bloaters. This is because chronic bronchitis patients are cyanotic, meaning that there is a lack of oxygen reaching their tissues. Emphysema patients often have club nails and can be barrel-chested. Also, as mentioned in the slide before, they show an increase in ventilation and a decrease in cardiac output. Patients with chronic bronchitis show a decreased ventilation and an increased output, making these patients opposites. Emphysema patients show a non-productive cough, while those with chronic bronchitis show a productive cough. A productive cough means that within the cough, mucus is produced. Both COPDs can be due to smoking, while emphysema is better known as secondhand smoke. And that is my presentation on emphysema. Thank you for watching.